แนะนำอะไรลูกที่ยาใครลูกนายคุกกี้คลาสสิกเหรอ
Of course, my parents wanted me to be a doctor, just like my dad. Spoiler, that didn't happen. But growing up, most of the Thai immigrants we knew were doctors or nurses or somehow related to someone in medicine. And my parents' friends and all their kids were doing it, so I didn't really question it. But recently I started to wonder, why were so many other Thai immigrants in my community in medicine? And why did our family end up in a suburb in the middle of America?
See what I had to live with, Linda? Look how boring this place is.
Instead of one of the more fun coastal cities. Let's roll it back to the Roaring '20s and meet Prince Mahidol Adoyadet of Songkhla, the first Thai alum to graduate with an MD from Harvard Medical School. While studying in the program, he fell in love with the Thai nursing student Sangwon Thalapa. Their son, Buhibon Adoyadet, later became the king of Thailand and reigned for over 70 years. The king's portrait, along with the queen's, presided over our dining room table for decades. It turns out that the late king of Thailand was also just a Thai kid born in America with a doctor for a dad, just like me. The prince's dedication to his people's health earned him the title of the father of modern medicine and public health in Thailand. One of his many initiatives was partnering with the Rockefeller Foundation to develop one of its first international public health campaigns. After returning to Thailand, one of the first things he did was set up scholarships to support medical, nursing, and public health students. He also upgraded the country's medical schools and facilities, including Sirirat, the oldest medical school in Thailand and my dad's alma mater. So healthcare and public health were core values for the royal family, which laid the foundation for high-quality, accessible medical education across Thailand. But aside from special temporary visas for royal folks like the prince, there were really very few Thai immigrants in America. The Immigration Act of 1924 essentially cut off all immigration from Asia for 40 years. It wasn't until President Johnson signed the Hart-Celler Immigration Act of 1965 that Asian immigrants were really allowed back into the country. Of course, it wasn't wide open. The system was based on family unification and labor force needs. Emmanuel Seller, the bill's sponsor, assured conservative opponents that the bill would actually help keep America white. Since the people of Africa and Asia have very few relatives here, comparatively few could immigrate from those countries because they have no family ties in the United States. There is no danger whatsoever of an influx from the countries of Asia and Africa. The Immigration Act also provided visas to, quote, qualified immigrants who worked in acceptable professions, such as architects, engineers, lawyers, physicians, surgeons, and teachers, and restricted what they considered unskilled laborers. And there was a huge demand for doctors in America. There was a shortage of healthcare workers due to various wars, and in 1965, President Johnson signed the Medicare and Medicaid Act into law, establishing health insurance programs for the elderly and low-income Americans. So many more people would have access to healthcare, and America would need many more healthcare workers to support them. And the timing was perfect for my dad, because just 1 year later, in 1966, my dad graduated from medical school. And with no debt, because the public program was essentially free and subsidized by the government. 1 year later, in 1967, he was off to America to intern at Mercy Hospital in Buffalo, New York. He became one of the 1,500 doctors Thailand lost to emigration between 1965 and 1975. It's part of the phenomenon folks call the brain drain. The result was a severe shortage of doctors in the country, particularly in rural areas. Meanwhile, foreign doctors like my dad were helping to bolster healthcare in underserved and rural communities in America. After my dad's internship in New York, he applied to many hospitals for his residency and was ultimately accepted at the historic Homer G. Phillips Hospital in St. Louis, Missouri. The Homer G. Phillips Hospital was named after a local black lawyer and civil rights advocate who helped plan it, but was murdered a year before construction in 1932. It was the only public hospital for black residents in St. Louis until desegregation in 1955. The hospital was located in the historically black neighborhood of DeVille and was a centerpiece for the community. It was also the premier training hospital for black healthcare workers, and one of the few places where black doctors could get a residency to train. By 1961, the hospital had trained the most black doctors and nurses in the world. However, after desegregation, black doctors finally had more opportunities to train at other hospitals, so they began spreading nationwide. This created the perfect opening for new foreign-born doctors like my dad to further his training in surgery at the public Homer G. Phillips Hospital in 1968. 56 residents joined my dad that year. While some of the residents came from historically black colleges and universities, most of his peers came from around the world, representing the Philippines, India, Haiti, Turkey, Colombia, Mexico, and Thailand. My dad would go on to work at several other hospitals in St. Louis over the years, but his residency at Homer G. Phillips was the first step to settling down in the region. 1968 was also a huge year for housing justice. The Federal Fair Housing Act was signed into law on April 11, 1968. This meant that a few years later, in 1975, my dad could now participate in the American dream of homeownership. With a $9,000 down payment and a 10% interest mortgage, he was the proud owner of a 4-bedroom home in the suburbs of Creve Coeur, Missouri. And after building some equity, he quickly traded it for my childhood home a little further west in Chesterfield in 1978. And thus began my family's life in the nice, boring West County suburbs of St. Louis, Missouri. We officially planted roots in America by riding the wave of decades of public policies and programs in Thailand and the United States. My dad's high-quality subsidized medical school education meant the overhead of student loans didn't burden him as he began his professional career. Demand created by war and public programs encouraged America to recruit foreign-born doctors, and the hard work of Black activists cleared the way for him to establish himself in the community. These policies paved the way for our family to access new opportunities and privileges that would have been unattainable to immigrants just a few years before.